What's going on, everyone? Happy Tuesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Tuesday edition of the Virus Update for Tuesday, October 8th, 2024. If you're new to my channel, this is where I do virus updates on all things COVID and any other virus that could be a health threat to you or basically make you sick. And COVID is one that is still making a ton of people sick. In fact, I still consider COVID to be a pandemic, as do a lot of other people who are aware of what is going on with COVID. You're going to see some things about COVID today that definitely make it still be a pandemic, and you're going to see some of the damage that COVID can do to your body. If you're new to my channel, subscribe down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. But before we get started, I do have to make a note about something. Yesterday, we did not do a pandemic update. Nothing was really wrong with me. I was just a little tired and felt off yesterday. Not that I have COVID, because I'm negative for COVID, trust me. When I feel off like that, sometimes I take a test. I did take a test last night. It was negative, as I thought it would be. It's just a part of long COVID. And those who deal with long COVID, trust me, I am sure you have played the game, Is It COVID, many, many times before, where you think you may have COVID, you test negative, and it's just a product of long COVID. And one of the things I deal with long COVID, because I had to get a blood test yesterday and I got the results back today, is vitamin D deficiency. I did not have this prior to COVID in 2020, and it's something that continues to be an issue, and quite frankly, it is not improving. So when I go see my doctor next week, it's going to be one of the things that I discuss with him is improving my vitamin D levels. Maybe it's time to up my vitamin D intake even more. We'll see. Anyhow, let's get into today's update. And starting off with New Zealand today. New Zealand COVID-19, 1,174 new cases, and they did add 5 more deaths. This is as of October 7th. Reminder here, we're doing a lot of things that we normally would have done on Monday. I mean, there's going to be times where we do miss a video here and there. It's not going to be every day anymore. We're going to have a couple days here and there where we do miss a video, and we'll make up for that. We'll catch up for the things that we did not get to see, such as B&O in just a little bit, which I'm a little concerned about B&O, and I'll explain why when we get to that. Increased emergency department visits for children with long COVID. So that's more utilization of the healthcare system, which is not a good thing. It's not something that we like to see, and we've known about this. We've known about this for some time. At the start of the pandemic, I think I mentioned this back over the weekend. At the start of the pandemic, we were told, oh, kids can't get COVID bad. Well, more and more evidence is showing kids can get it bad, kids can get long COVID, and it is increasing the number of emergency department visits in children because there are some children that are dealing with long COVID. Not all kids have it, but some kids who are infected do go on to develop long COVID, which is a problem. Speaking of long COVID, MRI scans reveal the damage long COVID does to your brain. Now, we're talking about adults now. We're talking about older ages, but researchers suggest lasting COVID symptoms might be an indirect effect of brainstem inflammatory injury, such as breathlessness and fatigue are a problem with this. And yeah, there have been so many studies on the brain, and this one will make it to the archive of my website. I'll put it in my other browser window where I have a whole set of things that I have to eventually catch up on. But yeah, the evidence is just mounting. Long COVID does such. The COVID virus, for those who do not recover and go on to develop long COVID, it really does damage to your body, and it's not good. The best way to prevent yourself from getting long COVID is not getting COVID at all and taking any precautions that you can. Alright, let's take a look at the weekly update from B&O, and I will explain why I'm not necessarily thrilled with the B&O numbers. First off, infection levels. Yes, they're coming down here in the United States right now. that is some welcome news. New cases, 91,800. The average is 122,641. And that's down by 18,476. In the hospital, 4,187. That's down by 470. In the ICU, 509. That's down by 42. But here's where I'm not thrilled about. Are deaths starting to come down? Yeah, they are, but another week with 1,209 deaths, which means we're on a track to have more deaths this year than we did for flu with COVID. I mean, it's just still a thing. COVID is still a pandemic, and plus we just talked about two things in long COVID, which is just two out of many different things there are on long COVID, and you get the idea. COVID is still wrecking problems. I mean, you all remember my blood test story about Saturday morning. I went to get a blood test and the place was absolutely packed. I went to get a blood test yesterday at a different location of LabCorp. It was a little bit smaller location, but it was around lunchtime, and I still had to wait over a half hour, close to 40 minutes. They were busy. And I was asking the person, have you noticed, I asked the person that drove, have you noticed an increasing number of people coming in for a blood test since this pandemic started? And they said, yes, we've been way busier. I'm telling you, there's a lot of people that need to seek health care and are having new issues checked out. And a big thing that doctor's offices do, specialists, is blood tests. There's several different things they can do with the blood test. They can do allergy testing, all kinds of different things, and it's putting more strain on healthcare. All right, moving back to this now. With more than 1,200 new COVID deaths in the U.S. this week, the death toll for the past 2 months has risen to more than 10,000 just in the last 2 months. And you're led to believe the pandemic's over. Well, hello, this is from the summer wave. This is not from winter time. It's not from springtime. This is from the summer wave of COVID. Ridiculous. At the same time, new cases are dropping across the country in the aftermath of the summer wave. Only 32.8% of hospitals in the U.S. submitted COVID data this week, which is similar to last week, but down from 91% in early May. This means actual case numbers and hospitalizations are substantially higher. And remember, folks, in November, all hospitals will be required to report again, so we will see a little period where things get inflated. In other words, meaning we'll see the number just jump upward. That's because more hospitals will be reporting once again. This is the 8th week in a row with more than 1,000 new COVID deaths in the U.S. It's also the 238th week in a row with more than 4,000 deaths, or 1.2 million deaths in total. So far this year, 5.6 million COVID cases have been reported in the U.S., causing at least 381,888 hospitalizations with partial data, and, wow, 45,132 deaths. Yeah, higher than the early days of the pandemic, but a number that is still far too high. All right, let's take a look at what's going on with pollen levels, and 55% of the country is in low to medium status. Taking a look at what's going on with air quality levels across the country, you're going to see a mixed bag of things all around the country. Some areas are fine, some areas are not. The Northeast, let's start off with the good news. The Northeast, the Mid-Atlantic, Great Lakes, doing great. Southeast could be better. There are definitely some problematic areas. The Great Northern Plains on westward, yeah, take a look here. Montana, Wyoming, portions of Utah, portions of Idaho, portions of California, Oregon, Washington, all dealing with some really bad air qualities at this time. Now taking a look at the latest on Hurricane Milton, and what can I say? It is a Category 4 hurricane. If you live in Florida, I hope you took this seriously. If you're in the path of Milton, I hope you decided to do the right thing and evacuate. I know evacuation traffic yesterday, I was seeing it on Google Maps. Florida 511 was absolutely insanity. Not as much today, still some, but that's telling me some people may have stuck around, which is not a good thing. And Air Force hurricane hunters have been flying into the storm. They'll continue to fly into the storm. I mean, it's only 2 miles per hour away from a Category 5. It very well could be a Category 5 on the next update from the National Hurricane Center. Let's take a look at that NHC track. You can see here, it's still aiming right for Florida. I'm thinking personally, it may hit just south of Tampa Bay. There have been some jogs to the eastward a little bit. We'll have to keep our eyes on that. It could easily shift back north to Tampa Bay, but anywhere within this cone here, really needs to pay attention. Anywhere from Tampa down to Sarasota, you really want to pay attention to this storm and take it seriously, because this is going to be one of the strongest hurricanes we have ever seen come from this direction into Florida. Alrighty, want to learn more about climate and weather? I've been tweeting a lot lately over on my Climate Data Report account on Twitter. For more on it, follow there. I'll be tweeting as the storm makes landfall tomorrow. I'm going to be doing a ton of tweeting on that. Taking a look at Philadelphia, and I do need to refresh this, I think. Here we go. Philadelphia on Monday had 899 EMS incidents, and because we missed yesterday's update, we've got to show you Sunday too. 800 EMS incidents were reported in Philadelphia on Sunday, and let's check here. I've been waiting for the monthly update out of Philadelphia wastewater. Let's see if it came in, and hopefully we can give you a monthly update. It does look like we have something here. Yes! Finally, wastewater has updated in Philadelphia, and it looks like, take a look at this, levels have been starting to drop in my city of Philadelphia. Also, today is Tuesday. I just remembered, today is the day that Pennsylvania wastewater updates. So let's take a look at what's going on there. And you can see here, blues are showing up, which means decreases. There's also a lot of counties with no change, but we do have one place which continues to stubbornly rise, and that is Westchester, the northern site, in between Westchester and Exton, Pennsylvania. Anyone in southeast Pennsylvania, you'll probably know where this is at. It just continues to rise there for some reason, so that's stubborn. That's not good. Hopefully we'll see that starting to drop soon. And we do see a lot of areas that are decreasing. Decreases up in Center County, Pennsylvania. That's actually some really good news, because they've had multiple weekends in a row with large crowds who came in for Penn State football games. Alright, moving on now to the viral activity level in Canada, and let's take a look at that for today. And we will see here that COVID viral activity level has now hit high. Flu A is low, Flu B is low, and look at this. This is new. RSV is now up to moderate. So we have moderate RSV, and COVID viral activity level in Canada has now gone up to high, which is something that we are not happy about. Ugh, that's not a good thing to see. Alright, Walgreens this week. There's some good news, mostly good news here. A little bit of bad news. But the good news is the positivity rate on Walgreens for COVID this week is 18.4%. The prior week was 21.8%. That's down by 3.4%. Total tests, 6,492. That's bad. We would like to see the testing not drop, but it is what it is. We're in between waves now. And last week was 7,788 tests. Now, there's some places on here that hardly are doing any testing. For example, Massachusetts, 75% positivity rate. You're thinking, whoa, data report, that's really bad. Yeah, it is. And I'll tell you why it's really bad. Only 4 stinking tests for COVID were done at Walgreens in the state of Massachusetts. That's ridiculous. That's why you have the 37.5% rise. And then you see here, last week there were 8 tests, so, the tests there are dropping like crazy. New York State, 34.3% positivity rate this week. Prior week is 35.9%. Difference of down 1.5%. Total test, 306 versus 435, so testing dropped there. West Virginia, we do see that there is a rise in the positivity rate, 32% versus 22.7%. That's a difference of up 9.3%. Total tests, 25 versus 44. South Carolina, this is another one of our troubling states, and this is actually a legitimate rise. 21.9% is the current positivity rate for this week. The prior week was 13.5%. That's a difference of up 8.3%, but you might think, oh, well, testing dropped. No. 151 tests versus 148. So, yes, this is one state that, for whatever reason, is seeing a legit rise. Let's go somewhere where things are in the green. Wisconsin, 21.3% positivity rate versus 28%. And that's down by 6.7%. Total test, 174 versus 161. Let's go to a big state. Texas, 13% positivity rate versus 15.8%. That's down by 2.8%, and they do a lot of testing still. 1,043 tests versus 1,227, and I know there's someone out there that's getting ready to hit that keyboard and say, well, Texas has millions of people. That's not a big number. For this day and age, that's still a big number considering nationally, what's the number again? 6,492 tests. Yeah, well, 1,000 of those tests were just in Texas alone. How about California? California does not do a lot of testing anymore. 19.3% positivity rate. The prior week was 23.2%. That's a difference of down 3.8% total tests. 243 versus 285. Let's go up to Washington. Washington's positivity trend, 17.4%. The prior week was 28%. Difference of down 10.5%. Total test, 109 versus 161. And let's do things in a little bit of a reverse today. Let's go to a state that's trending in the wrong direction to end Walgreens. Arkansas, 15.1% positivity rate versus 14.3%. That's a difference of up 0.8%. Total test, 53 versus 63. We'll take a look at more Walgreens on the next virus update. Keyword, next virus update. Hopefully that will be tomorrow. Let's not take a look at wastewater. Let's take a look at this. Epidemic status. It's improving in just about all of the country right now. There are a few states that are not changing. Georgia and Louisiana are not changing at this time. Here's the latest variant update. KP.3.1.1 is at 58.7%. KP 2.3 is at 9.4%, and XEC is at 6%. I do believe we get a new variant update this Friday. That is one day I do intend to, no matter what, we will get an update out on this on Friday, because this is oh so important. We want to see how much the XEC variant increases on this week's update. Will it go over 10%? Stay tuned. We'll have to find out on Friday. Providing the CDC does update on time. Remember, Indigenous People Weekend's coming up. Maybe they're just going to dodge and give themselves a 4-day weekend. I don't know. Taking a look now at New Jersey for today. 373 hospitalizations with 68 out of 70 hospitals reporting. In the ICU, 36 at this time. Discharges. There have been 35 discharges reported in the last 24 hours. New York State. This is a really good and impressive number. I mean, New York State is really dropping. Look at this chart here. This is fantastic. Tested positive, 508. Yep, that's the lowest number in a long time. Number of people in the hospital is at 850, but it looks like that number has been the same for several days, which kind of raises a question mark. The number in the ICU is changing, but the number in the hospital, you can see here, I think this is what? Yeah, second report in a row that's been 850. The number in the ICU is at 78 at this time. Let's take a look at hospital admissions real quickly. And we will see that New York State hospital admissions, they do continue to drop at this time. Alrighty, finally, if we can, taking a look at Virginia. I've been refreshing this all afternoon, and I am not getting any, let's see here. Now, we're not getting anything out of Virginia. It says during the week ending in the 8th, but if you take a look here at the data here, it looks to me like this is way lagged. See that number there? You're seeing, or the date I should say, you're seeing the 7th of September. Yeah, that's not making much sense to me, but take a look here. We do note here, at that point in time, RSV was seeing a little bit of a rise, and it says here, yeah, it says last updated September 10th, 2024, but if we come up here, it says data ending in the week of 10-5-2024. So it looks like maybe they had to pencil in a number up here. I don't know what this is about here. It says 1,393 or 1.18% of all ED and urgent care visits were for diagnosed with COVID. I assume that is continuing to come down significantly. Alrighty, folks, that does it for the Tuesday edition of the virus update. We will have another virus update again in the future. Perhaps maybe it will be tomorrow. I don't know. Until I see you again next time, stay safe, everyone, and remember, continue taking this virus seriously. Let's go back to here real quickly. Children are seeing increased emergency department visits for long COVID. MRI scans are revealing damage long COVID does to your brain. You don't want any of this to happen. And plus, COVID. Learn from me. COVID can cause you to have vitamin D deficiency. Remember, I did not have that problem showing up in my blood test prior to having COVID back in 2020. And now it's a problem that, it's leading to various different things. One being tired and who knows, this soreness that I'm having in my arms from these injections that I'm getting for asthma, that could be being enhanced by vitamin D deficiency. So, yep. Alright, see you all again next time. If you're new, subscribe down below, give this a thumbs up, hit that notification bell, share these videos with anyone you know, and I'll leave all of your comments down below. I'm sure I'll see a whole bunch of comments today. Until I see you again next time, have a fantastic Tuesday evening. Stay safe, take care of yourself, and thanks for watching.